Thank you so much for coming. And so just to answer your question, some people are asking me, so I'm a MD, so I'm a medical oncologist, and also diplomat of American Board of Medical Acupuncture. So I'm also a medical acupuncturist, and also have a Master of Science degree in clinical research. So I'm one of the two integrative medicine doctors in our center. And so welcome. So first, I just want to talk about, what is integrative oncology. So basically, it's a sort of a service that uses non-pharmacologic complementary therapies to provide help to patients to fight with cancer symptoms and cancer treatment-induced side effects. And it's inexpensive, safe, and effective, and evidence-based. So just to try to distinguish that from alternative medicine, so basically we try not to use alternative medicine, mainly because right now there's really no viable alternative to mainstream cancer care. So we try to do this evidence-based complementary integrated medicine that goes together with mainstream cancer care. And in the next 10 minutes, I'll talk about different modalities of integrative therapies. So basically, integrative medicine therapy has been shown to help with all these symptoms listed below. And our center is actually based on 74th Street and First Avenue. For those of you who have not been there, it's a lovely building. It used to be a bank, so very safe. And and beautiful place and beautiful lobby. So if you have time, stop by. And there we offer different kind of modality of treatment, such as massage therapy, acupuncture, dietitian, dietary consultation, and exercise program, yoga class, and all type of integrative approach. And in addition, as physician, we actually offer integrated medicine consultation to patients. And so that we practice in, Dr. Dang practice on 53rd Street, and I practice on 66th Street in the Bayak building. And in addition, we also offer different treatment for patients as inpatient service. So there are 6 major modalities of integrative therapies. So the first is massage therapy. Everyone loves massage. It makes you very comfortable. And in addition, there has been some data behind it. Basically, it shows that it indicates transient but welcoming and important benefit. And we have done a study on 70 pediatric cancer patients, randomized them to 20 minutes massage therapy for half an hour. 24 hours before and 24 hours after chemo, and that showed significantly reduced chemo-induced nausea and vomiting. So that, and then next, I would say the third speaker, Ms. Michelle Schumann, will talk about massage therapy. And then mind-body techniques. So that includes so many modalities such as meditation, self-hypnosis, yoga, which is both exercise, physical activity, and mind-body technique, and qigong, tai chi, and relaxation therapies. So the whole idea is once you calm the mind, you can calm the body, and you'll feel better. So meditation, multiple studies have been done and show that meditation helps decrease pain, anxiety, insomnia, and stress. And also there has been some dose-response effect being documented. So it's easy to implement. You can do it at home. We do have a mind-body expert, Robert Schmier, that provide you expert sort of consultation on this and kind of teach you how to do certain mind-body approaches. And once you learn that, you can do it at home. And then, yeah, it's free of cost, no side effects, and pleasant and pretty effective. And we also developed this self-hypnosis free podcast on our website. You're welcome to download it and do it at home. That helps you to relax and decrease stress. So later on, Robert Schmier will give a talk on this area. And also yoga. So there's gentle yoga and vigorous yoga. So gentle yoga really help you to calm and calm down and kind of a different way of meditation. We offer different kind of yoga classes. We also offer individualized yoga session if you're interested. So this is a great exercise to help you to de-stress and stretch. And also we have music therapy. Right now it's primarily inpatient service. So as inpatients, if you request, lots of people don't know about it, but if you request, anyone can get free music therapy at bedside. And we have a wonderful team. So that, basically, we use it to kind of provide general stimulation for patients while weaning off them on sedentary medication. And also it can lower blood pressure and help patients to relax and just make people feel much happier. So once, if you become an inpatient, feel free to ask for this service. We actually also have some music therapy offered as outpatient. So I learned that in M15, in the adult recreation pavilion in the main hospital, we offer this outpatient music therapy twice a week. So it's Wednesday at 2 o'clock and Thursday at 3 p.m. So feel free to join. It's all free, and just go there and enjoy the music and relax. And acupuncture treatment. I'm a medical acupuncturist, so this is dear to my heart. And this is medical, sort of a medical technique that developed in China over 3,000 years ago. And it involves putting in filiform needles in predefined acupuncture points to elicit therapeutic effects. And it's not magic, and we have been, although some people do say it's like magic, some people, we have been trying to do different kind of research to try to study the mechanism of acupuncture. Right now, it's a general consensus that it works by modulate the nervous system, basically stimulates the parasympathetic nerves and then calm down the sympathetic nerves, and therefore, usually after session, patients feel much more relaxed. And so far, there have been thousands of clinical trials on acupuncture. This is one of the most well-studied modality. And it has shown that acupuncture really helps with common symptoms, such as pain, and especially chemo-induced nausea, vomiting. And also, there has been some evidence suggesting that acupuncture is effective in treating hot flashes, dry mouth, and all those different things. And most importantly, all this study has shown that acupuncture is very safe in the hands of experienced acupuncturists. And our center, we actually have, including me, 5 acupuncturists, and we offer treatment to all kinds of patients. And later on, Jonathan Simon will give you an introduction, detailed instruction on acupuncture therapy offered by our center. And for those people who don't like needles, acupressure is actually a wonderful alternative. That basically means rather than using the filiform needles to put in your acupuncture points, we use pressure, physical pressure. You can use your fingers, your elbow, or anything can apply pressure. And we usually, if you ask, we can certainly teach you certain points. There are certain points to treat, chemo-induced nausea, vomiting, pain, different kind of pain, anxiety, and even depression. And then diet and nutrition, that's really important. In Chinese medicine, there's a saying that you are what you eat. So it's important what you put in your body. And so far, major cancer organizations estimated that 25% of cancer cases worldwide are related to sedentary lifestyle and obesity. And also major organizations recommend physical activity and healthy diet. Also there's survival advantage to healthy diet, especially if follows through puberty. So when we do physician consultation, we usually start with consulting patients on diet, then physical activity, then stress reduction, and also discuss supplements. And later on, Simon Young will talk about dietary herbs and supplements. So stay tuned. And then lastly is physical activity. So that's an exercise program. And basically, there has been lots of clinical trials showing that exercise is really important and beneficial for cancer patients. And so all exercise is good, and so usually we recommend patients to at least do moderate exercise, such as walking for half an hour per day, if they can. And then in addition, other exercise such as vigorous yoga and group exercise like Tai Chi or Qigong, and exercise classes are truly beneficial. So you're welcome to come to our center and learn more about them. And later on, Donna Wilson will talk about fitness program. So basically, we believe that integrative medicine therapies can be used anytime for cancer patients and cancer survivors, pre-op, post-op, and during recovery and thereafter. So lastly is our center also developed this education and information website, this About Herbs website. And Simon Young will talk about this in detail since he's the one kind of started this. So it includes 270 entries on dietary supplements and basically talk about the constituents, mechanism of action, and possible adverse reactions and possible drug-herb interactions. So. And then they're all free. So it's a free app on your iPhone or iPad. So just download it and read about it. And if you have any question, feel free to talk to us as physicians. And Simon Young started this website, so he knows everything about this website. And he will be here later today. Okay, so welcome, and it's an exciting day coming ahead.